Today, we're diving deep into a true medical emergency, status asthmaticus. This is a severe, life-threatening asthma attack, and it demands an incredibly precise and rapid response. So, let's break down exactly how medical teams handle this critical situation step by step.
Here's our game plan. We'll start by defining what this is, walk through the different stages of treatment, see how these protocols actually change over time with new science, and then wrap it all up with a big takeaway.
All right, first things first. What exactly are we talking about with status asthmaticus? And, what makes it such a major medical emergency?
So let's be really clear here. This is not your typical asthma flare-up. We're talking about a situation that has escalated into a true crisis. The standard relief inhalers, the ones that usually work, they've stopped having an effect. The patient's breathing is just getting worse and worse. It's a terrifying possibility for anyone with asthma.
And you might be surprised by what often kicks this whole thing off. It's usually not some dramatic exposure to an allergen. More often than not, it's something as common as a cold or the flu. It just goes to show how a seemingly routine illness can spiral into a life-threatening event.
So, how do medical teams respond to this chaos? Well, they don't just wing it. They follow a very clear, established protocol, just like the one laid out in this medical textbook. It's a detailed, step-by-step plan that's designed for a fast, escalating response. So let's get into what that actually involves. The moment a patient in this state arrives for emergency care, the clock starts ticking and the protocol kicks in with a powerful first wave of treatments. The initial response is this really potent three-pronged attack. Right away, they start powerful IV steroids to fight that deep inflammation, though those can take hours to really kick in. At the same time, they use nebulizers to deliver drugs that open up the airways fast, providing some immediate relief. And of course, high-flow oxygen is given to provide crucial support. It's a coordinated race against time.
But here's the thing about this condition. It's known for being resistant to treatment. So what happens if those crucial first steps just aren't enough to stabilize the patient? Well, the protocol escalates.
Okay, this is where the strategy has to shift from just treating the lungs to treating the whole body. If the airways are so tight that inhaled drugs can't even get in, they'll use injections to open them from the inside out. They're also pushing IV fluids to fix dehydration and correct something called acidosis, a dangerous buildup of acid in the blood that happens from the incredible effort of trying to breathe. Now we move to the most severe cases. This is when the patient is becoming exhausted. They're physically unable to get enough air, and the team has to pull out all the stops with life-saving measures.
At this point, the protocol calls for mechanical ventilation. This means a machine literally takes over the work of breathing for the patient. It's a really invasive step for sure, but it becomes absolutely essential when the body is just too tired to keep fighting.
It's so important to understand what's happening here. Ventilation isn't a cure itself. It's a life-saving bridge. It buys precious time. It lets the patient's body finally rest, and it gives those powerful steroid medications the hours they need to finally get that inflammation under control and open up the airways.
And while all of this is going on, the medical team is also kind of playing detective. Remember how we said the most common trigger is an infection? Well, they'll often start intensive antibiotic therapy right away to treat any potential chest infection that might have set off this whole terrible cascade.
Now, what's really fascinating is that this protocol isn't some ancient text carved in stone. It's a living document, constantly being updated by new research. The story of a drug called aminophylline is a perfect example of how medical science is always evolving.
This is literally the scientific method in action. You see, for years, aminophylline was a standard go-to treatment in this emergency. But then, new evidence came out showing that for most patients, it didn't really offer any extra benefit and, in fact, could have some nasty side effects. So what happened? The protocol changed. Now its use is restricted to only the toughest cases that don't respond to anything else.
So after walking through this really intense medical scenario, let's pull back and put it all together. What is the key takeaway from this whole protocol? When you look at the whole picture, the ultimate takeaway is the power of having a structured plan. For a condition that is so frightening and chaotic, there is a clear, systematic, and evidence-based protocol to fight it. Every single step, from that first dose of oxygen to life support, is part of a logical, escalating response designed to save a life.
And that really leads us with a final thought. This incredibly detailed protocol is a snapshot of our best medical knowledge right now. But that same process that refined the use of aminophylline is always happening, always working in the background. So the real question isn't if this protocol will change, but how and when, as new evidence continues to build the foundation for tomorrow's breakthroughs.